The nation's largest measles outbreak is intensifying right now. New numbers from South Carolina show new cases have doubled since Tuesday, reaching a total of 558. The epicenter is rural Spartanburg County. More than 80% of the measles cases in the outbreak, they were in unvaccinated children. That's according to the South Carolina Department of Public Health. Dr. Jessica Shepard, Chief Medical Officer of HERS, joins me now for more on this. Dr. Shepard, thank you for being with us. Measles is a serious disease that can make people very ill. We know that it's especially high risk for young children. Why is that?
You know, measles is actually very, very contagious. And when we look at children, we want to look at the immune system of children. And that's really where we see the issue and why vaccines work. So just looking at it from a perspective of health, is your immune system is made to fight off infection. Now, when you don't have the ability to do that, that's where you typically start to see that if you're exposed to an organism such as the measles virus, this is when your system is not able to counteract or fight that disease. And this is why we're starting to see, just like you said, in unvaccinated children, one being a very infectious virus, being exposed to unvaccinated children, not having the immune system to fight that virus off.
And so, Dr. Shepard, when we talk about this, we are often told that vaccinations are the best way to protect yourself. Where's the confusion coming? Why are there people who are not getting vaccinated, who are skeptical about it? Can you explain that?
Yeah, I think, a lot of the skepticism comes from choice being taken away. And I can understand that for people who feel that from the vaccination, when there's a schedule and a routine, that it feels like it's being told to you. But there is a reason why this is done. And I think that historically, when people understand just how much vaccinations have done in the history of disease and decreasing that and decreasing death. So it's not always about the disease, it's actually about dying. So particularly for measles, this is when you get, again, in childhood, that MMR vaccinations for measles started in the 1960s, and they saw between 100,000 and 800,000 cases annually of measles. And so they killed about 2 to 3 million people each year. And so measles really remains one of those very contagious viruses. And the measles vaccine is 97% effective. And so when we look at prevention of death being as much as 60 million deaths worldwide that it's decreases and prevented, this is really where we want to focus the numbers on. And when you make that decision, is you're not just saying someone's telling me not to do something. This is actually going to decrease death.
So if you aren't sure about your vaccination status, what should you do?
This is where you start to have that relationship and discussion with a healthcare provider, because this is where we are educated, and this is where we want to help people, is allow them to understand what vaccines are and if this is something that you should do for yourself and your family.
Thank you so much, Dr. Shepard. And ABC News has a new map to see your neighborhood's risk of measles outbreak. Just go to abc7.com/measles and enter your zip code.